Good evening, everyone. A warm welcome to our Less Than Full-Time Training webinar. Thank you so much for joining us today. My name is Radha Segal, and along with my colleague Venetia, who you'll meet very shortly, we are junior doctors and National Medical Directors Clinical Fellows at Health Education England, and we're delighted to host this webinar today on behalf of HEE. We're joined by some fantastic speakers tonight. They are Mr. John Hussain, Deputy Dean and Lead Dean for Less Than Full-Time Training, Dr. Jennifer Southern, a Less Than Full-Time Trainee, Dr. Helen Goodyear, Associate Postgraduate Dean, Less Than Full-Time Training, Careers and Professional Support, and Dr. Shirley Remington, Associate Postgraduate Dean and Learner Support in the Northwest. We're also joined today by Charlotte Verity from NHS Employers and Kieran White from the HE Medical Education Reform Team. The agenda for the next hour will include presentations on Less Than Full-Time Training, a Q&A with our panel, and ending with an interactive polling session to gain your views. I will now hand over to my colleague Venetia for some housekeeping before we start.
Thank you for that, Radha, and thank you to all of you for joining us today. So for a bit of housekeeping, the event will be recorded for those unable to join live. However, the polling session will not be made public, and any comments or feedback provided during the polling will be completely anonymous. We will be using Slido during the polling session, which is an interactive polling platform. We will show you how to access this later. For those who have submitted questions in advance, thank you so much, and we'll be answering many of these during the panel Q&A session. As this is being broadcast to many people, we weren't able to answer questions on personal or individual circumstances, but we'll try to answer broadly if we can. Also, please feel free to post any comments or questions during the event this evening via the Q&A function on Teams, as this will be monitored throughout. We will try to answer some of these questions at the end of the event after the polling session. Please be aware that due to the high volume of questions, we won't be able to answer them all and will focus on those with the most likes. However, we will be producing and distributing after this series of webinars a PDF with further information, which will also address some of your questions. We hope that you enjoy the event, and it's our pleasure to introduce you to our first speaker, Mr. John Hussain.
Evening, everybody. The usual issue of trying to unmute. So thanks ever so much for joining us this evening. This is the second of 3 webinars. I've been involved with managing Less Than Full-Time Training in Yorkshire since about 2014, and I took on a national role in 2017 to lead Less Than Full-Time across the 4 nations. I'm going to focus a lot of the work that we've been doing in England at present. But there is work we're doing across the 4 nations, and if there are trainees in the other devolved nations, some of this work will be coming to you. Normally, in my role as lead dean, I would normally be holding a meeting, a face-to-face meeting with quite a wide faculty. So we've tried to reproduce in this webinar what we'll be doing face-to-face. Really important that trainees are involved. Most of the best ideas I get in Less Than Full-Time come from trainees. We've also got 2 very experienced members of faculty who've been managing Less Than Full-Time longer than myself. That's Shirley and Helen from 2 other HEE offices. And I've also got some colleagues from the MERP faculty, that's the Education Reform Team, who've been really helpful in pushing things forward. Now the next slide, Claire, please. So really quite simple when I took on this role. This is what I set out to do. It's not proved so simple, but these are what we've been trying to do and what the aim is. The first bullet point is probably the most important, is that everybody who wishes to should have the option to work and train flexibly, and for me that should be for whatever reason you wish. And we've been really trying to push that forward. For those, if you're worried about that, this is actually written down in the NHS long-term plan and in the people plan. And they want it to apply to all people that work in healthcare, and they're really looking to see what we're doing in medicine to try and lead the way. The second thing we've been doing is to try and remove the barriers. So we've been trying to make the process to apply a lot more smooth, trying to get some more information out there and been trying to educate people, particularly your educators and your faculty, around what we should do. And I'll talk a little bit more about widening access with what we've called category 3. Really important that less than full-time trainees shouldn't be disadvantaged, and I do pay tribute to colleagues from the BMA and people from NHS employers, because in England they've managed to negotiate that all less than full-time trainees will get a bursary or get an extra payment of £1,000 a year, to try and make up for some of the issues like college fees and GMC fees. But we continue to work on that. The other thing that we continue to work on is to make sure that faculty are educated around ARCP. The last two have probably been the biggest challenge at all, because there's lots of myths and rumours about less than full-time trainees. You're not working properly, you're not there half the time, you're not committed to your specialty. And I mean, I speak to you as a surgeon. There is a view in surgery that less than full-time training isn't possible. And it's not just surgery, it also happens in the academic world. People think you need to work probably more than full-time. So doing a lot of work with colleges and with the other organisations like the academy and trainee groups and the employers to try and do that. And to do that, we need some evidence, and I'll show you a little bit of evidence later. So next slide, Claire. So just a little bit of a conversation about what we did do. The Gold Guide has categories 1 and 2, where you have to give reasons to train less than full-time. We introduced category 3 as a pilot a few years ago, firstly in emergency medicine, where we allow people to work flexibly as a personal reason. Don't give us a reason, but you can just go off and choose what to do. And we've piloted this in emergency medicine. We've extended it to some other specialties which you see listed. And as of this year, next slide again, Claire, please, we'll be extending it to every specialty within England. So if you want to work less than full time, and I know there was a few people on the webinar the other day and are thinking about it, you can do for whatever reason from this year. Next slide, please. We've brought it in gradually, so when it starts in a specialty, just to make people feel a bit more comfortable, we're giving people a sort of a lead-in period just to trial it, just to make sure that the work doesn't fall down, and then we go for full implementation. Next slide, please, Claire. And again, the next one. So this is probably the most important thing I want to show you. This is part of our external evaluation and part of the evidence that less than full-time training has a positive impact on trainees. And if you have a positive impact on trainees, that's better for our patients. You can see on the left the very high scores of trainees having their work-life balance, of their well-being, and having positive job satisfaction. And with the pandemic, that's really quite important. You'll also see there's some increased evidence of people having better engagement with their supervisors, feeling they're better at providing their job. And then really interesting in the middle, some evidence actually that less than full-time trainees are performing better than their full-time colleagues. There may be a COVID effect related to this. It may be the trainees are protected from burnout, but we need a little bit more work to look into that. But that's really strong evidence and something that I show quite regularly and something I ask people to share. So next slide, please. So what I'd normally want at these meetings is I'd want your questions. I'd want you to ask what questions you have. We'll try and answer some today, and if we don't get round to them, we are committed as faculty to get some answers out in an FAQ sheet for you. I want your ideas and I want your good practice. I want you to tell me what works well, because if you have worked out how to be a less than full-time trainee in cardiothoracic surgery, we need to understand that. And then finally, we want to understand what are the blockages, why are you encountering problems, and the team have got some questions, Slido, later on. So I'm just going to move on from here and do what I normally do, which is introduce you to one of our trainees, and I'm delighted to introduce you. That's my contact details. I'm really open to having any of you contact me through my HE address if you've got some questions, and I did get some very good questions following the first webinar. So as I was saying, I'm delighted to introduce you to one of our trainees from my patch in Yorkshire. Jennifer's one of our emergency medicine one of our trainees who's been working less than full-time in core of emergency. So I'll hand over to Jennifer to give you the trainee perspective.
Hi everyone, I'm just going to see if my slides are going to show up on here as well, but my name is Jennifer. I'm one of the less than full-time ACCS trainees. I'm actually anaesthetics, but my first year, because it's ACCS, was acute medicine and then emergency medicine. So could we do next slide, please? Great, so I'm going to talk a little bit about me just so you can see how far I am into my training. A few of the reasons for why I went less than full time in the application process for it, and my experiences so far in general conclusions and recommendations. And next slide, please. So I went to medical school in 2011 to 2017. Then I applied for an academic foundation programme for my first 2 years. So that's all full time. F3 happened during the pandemic, so I'm sure I'm not the only one who will say it was a little bit not as I planned, but I did do some fun things like be a trauma fellow and do some critical care. And then I started my ACCS anaesthetics kind of 3 to 4 years, it's currently 4 years now, training programme in 2020 in August, and have been going on since then. So I actually started that at full time, initially doing acute medicine, and it wasn't until I started the emergency medicine rotation that I switched down to 80%, and I've continued at 80% since then. Next slide, please. So my reasons for going less than full time, I'd say that it's somewhat personal, but I think that my mental health as a result of some of the rotations that I had experienced had not been very good. And when I was faced with the possibility of redoing, unfortunately, emergency medicine again, I knew that that wasn't going to be very good for me. And so I had to think quite hard about what I wanted to do. And I concluded that I would probably be okay and would be able to carry on doing an anaesthetics training programme that included 6 months of emergency medicine if I didn't do it at full time, which I'd previously done and experienced in quite a negative way. Next slide, please. So the application process for me at the time, I would probably give it about a 3 out of 10. It was when the pilot scheme had just been introduced, and I think the people who I was applying through it with were not very familiar with the application process. So it didn't go particularly smoothly. Initially, I tried to apply under the pilot scheme for criteria 3 for emergency medicine, but unfortunately was told that although initially they thought it would be applicable for me, I was then told it wouldn't be, unfortunately. So then I spoke to my supervisors because I was still quite concerned that I was going to be going into a rotation that I knew would be very bad for my mental health and I would struggle to manage with. And I had some really supportive educational and clinical supervisors who really did help me with the application process. And so I went through it again and applied saying on mental health that I should probably not be doing that job again at 6 months full time. And after an online meeting with HEE, which was generally very well supported, they allowed me to go less than full time, which was absolutely, as I've graded it, 10 out of 10, the best decision. And it meant that I had a much better experience of going through emergency medicine again. And as I've continued it into anaesthetics, I still think it was the right decision, even to continue into a specialty, which I knew I was going to enjoy and be a lot happier in anyway. Next slide, please. So what would I say about my experience so far? So I'd say that the positives greatly outweigh any negatives or any worries or problems. I'd say that you generally, as a result, if I look at how many hours you do, the typical CT2 for anaesthetics would be doing sort of 46.5 hours a week, whereas my average is somewhere around 37.4. So it's not a huge difference, but it makes a very marked difference to the time that you have outside of work. It means that you get a little bit more sleep, a little bit more exercise, you get to do other interests, and you can see a bit more of your friends and family. And I think as you get a little bit older, being able to go and see your parents and things more than maybe once or twice a year just becomes a little bit more important, and something which I probably didn't value as much when I just started medicine as I do now. You also just have a bit more energy personally for time, motivation for exams, that sort of thing. But I would say that I was concerned about any stigma, as Dr. Hussain mentioned. Yes. Okay, next slide, please. Okay, so overall, as I rush through all of the thoughts that I have about less than full time, I would say that in general, I cannot recommend it highly enough to those people who just have other things in their life that they want to pursue outside of medicine, or if they find that their time and the way that they're spending their time isn't what they want in their life. And I think this particular generation of people coming through medicine now are a lot more aware of what your work-life balance should be and what you want to do with your time on this planet. And I think that's really important. And that's all I'm going to say for now. There's a lot of things coming up on the web chat as well. I'm just going to pass on to whoever's next.
A big thank you to Jennifer and John for those interesting presentations and for sharing your really personal experiences. We are now going to move on to the Q&A session with our panel. Thank you again to those that submitted questions beforehand. And the first two questions are for Mr. John Hussain. The first question, can you undertake locum work or another role such as a fellow role whilst in less than full-time training in any category? And the second question, as an international doctor working on a visa, who can you approach for advice about the implications and eligibility for applying for less than full-time training?
So thanks ever so much. The first question about additional work was something that constantly got asked. We were asked about, and there was pretty much a divided school, and that some people felt you should be able to do what you want, and there are other people who felt that less than full-time was a privilege and you should protect it. We took the view that less than full-time trainees should have the same opportunities and should be treated exactly the same as full-time trainees. So the view, which we got agreement from the GMC and from the deans and from the employers and from the 4 nations, was that what you do in your own time is your own business. So you are able to do extra work, you're able to do work that you would do, you can do extra shifts if you require, or you could run a business if that's what you wanted to do in your own free time, provided you work within your competence and you let your responsible officer and your dean know what you're up to. And we produced a statement on that, which is on the COPMed website, and I'll ask that we make sure a link goes out to that. I think as long as you behave like an adult, people will treat you like an adult and you can do what you wish. The one rider to that is that if you are working less than full-time for a health issue and it's suggested that you shouldn't be working to protect your health, your dean or your supervisors wouldn't recommend that you do extra work, and you need to have a conversation around that, and that's done to protect you. It's not done to deny you anything. It's if you've got a health issue, you need to look after yourself. The issue with visas is a lot more complicated because it's beyond our control. This is something that's been decided by the Home Office. There used to be a thing called a Tier 2 visa, which overseas doctors were employed on with minimum salary thresholds, and that's been replaced now by a skilled worker visa. And they also have a minimum salary threshold, and they've decided that minimum salary to be the going rate, which is a very nebulous term. When we've pushed them on that, they said, well, that's the normal base salary for your post, or up to 80% of that normal salary, and they won't give on that. We've pushed them quite hard about that. So if you are an overseas doctor on a visa, currently the only avenue that you would have to work less than full time would be to work 80% on average. We do have a dedicated visa team within HEE, and again we will ask to make sure that that website gets published with the notes that come out from this, and they are able to respond to any particular visa queries that you have. So I think I'll just leave it at that for the moment.
Thank you for that, John. The next few questions are for Charlotte Verity, who is our representative from NHS employers. So we have a few questions for Charlotte. The first few relate to pay and financial implications. So is there a pay calculator so that you know you are being paid correctly? And what are the wider financial implications of going less than full time, such as pension calculations? And the next question relates to annual leave and bank holidays. How do you work out your annual leave and bank holiday entitlement when less than full-time? And what if a bank holiday coincides with your day off?
Thank you. So I'll start with the first one that you mentioned there around pay calculators. So we do have some guidance on the pay system for less than full-time trainees on our NHS Employers website. So this sets out how to calculate the various pay elements such as basic pay, weekend allowance and flexible pay premiums. And we've also got a weekend on-call availability allowance ready reckoner, which works out the commitment to the full-time rota and therefore the LTFT weekend allowance and LTFT on-call availability allowance. So both of those are available on our website. And we've also got the good rostering guidance, which is in conjunction with the BMA, which is guidance for employers and trainees on everything LTFT related and rotas, so how they should be rostered, and advice on annual leave and bank holidays, which I'll come to once I've discussed the further financial implications of going LTFT. So on that one, I will start with pensions. So at present, under the 2015 scheme, a member's pension paid is based on actual average earnings, whereas the member contribution rate is based on a whole-time equivalent salary. So for example, if an LTF doctor earns £30,000 but would earn £50,000 full-time, they pay the same rate of 12.5%. So this has long been seen as unfair to part-time staff, and one of the proposals in the consultation on changes to the pension scheme states that contribution rates should change to be based on actual pensionable pay instead of members' whole-time equivalent pay. So if this is approved, which we're hoping it will be, this is a positive change for those working LTFT, and it means that the contributions will be much better reflected in the pension benefits that they're building up. Other financial implications, so obviously training LTFT will result in a proportional reduction in pay compared to full-time colleagues. But I think John mentioned earlier about the LTFT allowance. So this was implemented as part of the 2018 review. So from December 2019, any doctor training LTFT will receive a £1,000 allowance, and this is to cover additional costs such as college fees and GMC fees. So moving on to annual leave and bank holidays. So LTFT trainees are entitled to annual leave and bank holidays on a pro rata basis. So for example, a full-time doctor that receives 27 days of annual leave and 8 bank holidays, a 60% LTF doctor would get 16 days of annual leave and 5 bank holidays. If the trainee was to work on a bank holiday, they'll then be entitled to pro rata time off elsewhere. I will just say that how annual leave is calculated might vary between organisations, so this might be in days, whereas for some it might be in hours.
Thank you so much for that, Charlotte. Our next question is for our less than full-time trainee, Dr. Jennifer Southern. There is often conflict between having a good work-life balance whilst trying to gain enough training experience and maintain continuity. Are there any tips for managing this in your experience?
Yeah, I thought this was a really good question, and is particularly relevant to anaesthetics trainees when you start out, because for those who don't know, the first 3 months approximately of your anaesthetics training is titled a Novice Period, and it's when you're essentially supernumerary and you're gaining all of your airway skills. So it's a very intense period of the rota and of your attachment to anaesthetics, and it's typically known as the one with an extremely steep learning curve. So I had the benefit of a very helpful doctor who was in the year above me, who had been doing less than full time as a parent and had done that novice period at 60%. And she had actually warned me before I started to be very careful about that period, because she'd found it quite hard to obtain the dexterous skills that are required during that time. So when I thought about how best to approach it, I was in a better situation as I was going to be at 80% rather than 60. But I did actually just speak to my secretaries and worked out when would be the best time to come in, how could I adjust my rota so that I could get the most out of those days, and just talking to the rest of the consultants about, you know, if a list finished early and I want to do some more airway skills, then where can I go in order to get some more practice? So I think, to be honest, It will be very specialty and even department dependent on what will work best for you. But what I did appreciate is having people who had done it before me with their advice, and having a department who were extremely friendly and very supportive about me wanting to just be as good as I can possibly be. The other useful thing is that you just have a discussion with your specialty consultant leads about when you want to progress to your next stage. So for me, for example, when you do your initial novice period, it's somewhere between 3 and up to 6 months, and you can progress to on-call duties anywhere after that 3-month period. So I could titrate how long I did that novice period until I felt ready to do so. And I might just be very privileged because anaesthetics is generally a very supportive specialty. But I think that should be something that all specialties aspire to. And it will certainly help other less than full-time trainees if they feel they can say, this is what I'm struggling with, this is what I want to do more of. These are the days where I'm not really getting much experience and I need to really optimise it. And if there's anything that less than full-time training will teach you, it's what you want to focus on, and you have a bit more reflective time when you're not at work to really think about what you want to be doing on your days at work rather than being very tired, for example. That's it for me.
That is a great question, and thank you for sharing your insights and your experience with us, Jennifer. The next question is for Dr. Helen Goodyear. How does becoming less than full-time affect the length of the training programme, and can you progress on the basis of completion of competencies rather than time?
Okay, well, an initial simple answer is that yes, it lengthens it. And I'm going to take looking at foundation training and then look at specialty training. So foundation training is strictly pro rata. So that, for example, if you are working at 60%, instead of 12 months for F1, you will need to work 20 months. If you're working at 50%, you'll need to work 24 months and so on. So foundation training, you must do the whole time equivalent. Turning to specialty training, it's different in different specialties. So there's always a minimum time which you must do, and then some of the specialties have competency or capability progression. So I will give you an example of my specialty, which is paediatrics. We always think we're the most flexible, but I think probably many other specialties think that. And with paediatrics, you must do 5 of the 8 years of specialty training. So to give you an example, ST1 to 3 is 3 years, but it can be done in 2 years if you've got the competencies and you've made a start on your membership exam. So what I would recommend to you is that when you know the specialty that you want to train in, or you're actually training in that specialty, find out the particular rules regarding time and competency for the particular specialty.
Thank you so much, Dr. Goodyear. Owing to a technical glitch, we lost Charlotte Verity earlier. She was talking about finances, pay, bank holidays and annual leave. So I'm just going to hand back over to Charlotte.
Thank you. Yeah, sorry, some technical issues. So I think I got up to talking about bank holidays and coinciding with a day off. So bank holidays should be incorporated into your overall leave entitlement so that these can be deducted as and when they're taken. So if the doctor's working on the bank holiday or not rostered to work on that day, then a day won't be deducted from their allowance. So yeah, if you are due to work a bank holiday or have a day off on then it should be rolled into your entitlement. And I think that covers all my questions.
Thank you, Charlotte. The next question is for Dr. Shirley Remington. Is less than full-time training frowned upon, and will it have an impact on future job applications and career progression?
I think the answer to that is a complicated answer, but let's take the second part first. Does it affect your job applications if you've worked less than full-time previously? There are the job applications where we move from one training grade to another, And those interviews are usually conducted in such a way that it is not immediately obvious to the people interviewing you whether you've trained less than full-time previously or full-time. So it really can't influence the outcome of those interviews. When we come to the consultant interview, which is quite a different interview with everybody probably with your full CV in front of you, it would very rarely affect a decision of a panel to take someone or not take them. And the reason for that is they're looking for someone who's a good fit with the department into which they're appointing, and also because they recognise that their consultants won't do the patient-facing hours that people do during training. And they also recognise that increasingly people at senior level wish to work less than full-time, so they have to make that adaptation, and they're appointing the person who will be the best fit. So I think the answer to that is no. Does it affect the way that you are treated or the way people react to you or support you? I think the answer for all senior educators is you will get overwhelming support to train in whatever fashion fits and works for you, and it will be tailored towards what you need, and it will not disadvantage you in any way. Does that mean that out in every trust that every senior doctor is supportive of less than full-time training or fully understands it? It'd be disingenuous to say that they all did. I think as less than full-time trainees, one can help seniors understand where they don't have an understanding. And even within trusts, in departments where there are people that don't understand it and maybe aren't so supportive, there will be other people that do, and indeed themselves may not be working full time. Increasingly, as time goes on and the percentage of trainees in a given specialty that are less than full time, the more people understand, the less of an issue it is, even with the rare individuals. But always the training programs are very supportive of this as a way forward and a way of training. The other folk that sometimes find it difficult to understand less than full-time training will be those people that are around you in other professional jobs, because maybe there isn't so much less than full-time working and there is no less than full-time training in some of those other areas. So it's about helping them to understand, and part of our job as senior educators is to make sure that all the faculty and all the people out there in trusts and practices understand what a good way it is of training and how it majorly contributes and will contribute to the workforce in the future. Thank you.
We had actually a lot of people asking this question, so thank you very much for answering so fully, Dr. Remington. The next question is for Kieran White from our HEE team. Are there restrictions on when you can apply for less than full-time training? So, for example, if you are close to your CCT date or if you're midway through a rotation?
Thank you. So, in general, the principle is that we'd like, and faculty and trust would like, as much notice as possible. So we try and say 12 weeks, which is the code of practice. But to cover off a couple of questions that have come through as well, it's important to note that all postgraduate specialties are able to apply for less than full-time under category 3 at the moment. So I just wanted to re-emphasise that. For the question about how close you can be to your CCT date, John, would you mind covering that point?
So there are various reasons why doctors would ask to work less than full time, and some of them aren't planned. I mean, you can't predict when your parents might get an illness, or even when you will get an illness, and there may be a time where your deanery has to make a very rapid decision to support you, and therefore the date of your CCT isn't really relevant to that. Each case would really be judged on their individual merits. Not if it's a normal planned less than full-time request, then we'd, as Kieran has said, we'd normally ask to use the usual 12 weeks notice for the rota. But if you've got individual circumstances, then we're here to support you. I mean, I don't know if Shirley or Helen, you've got a lot more experience of this with than me, longer, but I'm sure you would agree with that.
Very much so, John. I think for people that are returning because they've maybe had after they've had parental leave, or people that suddenly have the needs for carers leave to look after maybe an ailing partner or parent or even sibling, these things come up and you try to facilitate it happening as fast as you can, as you do for people that are coming back into the workplace, maybe who are unwell. And what we are planning when the full rollout of Category 3, which happens in August this year, in my locale, is to say, if you're a Type 3 LTFT applicant, we will ask you to apply and to go into place only as rotations change. And it's to make it easier for everyone to manage and understand and make sure we balance the placements of trainees so that we have a mixture of people that are both full-time and less than full-time out in our trusts. Kieran said earlier on that Category 3 is in place for everyone. The 4-month trial blocks are, but in some deaneries there was a period of expression of interest which in fact closed and is currently closed. Just for clarity for everyone. Thanks.
A couple of points. I think Category 3 is being implemented in different ways throughout the deaneries. So, for example, in the Midlands, we have a window of opportunity for Category 3 between February 28th and March 28th. So if you're thinking of Category 3, do check the particular deanery that you're working in. Just going back to implementing less than full-time training rapidly, do contact your associate dean or lead for less than full-time training if you have an unpredictable reason. I always say that doctors, like their patients, get ill unexpectedly, or they have unexpected caring duties. You know, an elderly relative or any relative can suddenly become ill. So the best way to facilitate it is for people like Shirley and myself to know about your circumstances and to know why it needs to be pushed through very quickly, and to liaise with the trust if the trust is saying you must give 3 months notice. I have to say that all the trusts have been excellent about this, and normally people in the trusts are very supportive indeed.
Thank you, John, Helen and Shirley, and a big thank you to all our panel for their answers and contribution to the event today. And I'm now going to hand over to my colleague Radha for the next item on our agenda.
I know that a lot of you have asked some questions in the chat, so I'm conscious we do want to try and answer a couple of those. I know some of them have already probably been answered during the Q&A panel session. Please feel free to drop off the webinar if you need to, but I just wanted to take a couple of minutes to answer some of the questions that had the most likes. So the first question I'm going to ask is, let me just have a look. So I'm just seeing which questions have received the most likes. So I think the first question I'm going to direct to Charlotte Verity. So this is about the less than full-time allowance of £1,000. Is that something that has to be applied for? And if so, how do you go about doing this?
Thank you. No, it isn't something that needs to be applied for. It's a payment that should be inputted into ESR by your employer. If you're not receiving that in your pay, you should be receiving it monthly. Pick it up with them, but no, you don't need to apply for that separately.
Thank you, Charlotte. So another question for you is, how does less than full-time affect maternity leave? Are you entitled to the full amount of maternity leave and pay? Or would it be related to the percentage that you are training at? Yeah, so you're not entitled to the full amount. It's based on your weekly average earnings. So this is usually averaged over an 8-week period. And this includes the end of your qualifying week. So the qualifying week is the 15th week before the baby is due. So short answer is it's based on your average earnings. Thank you for that, Charlotte. I'll try and ask a couple more quick questions before we come to a close. So I have one for Jennifer. How do you ensure that your training is protected and you're not just doing service provision?
Hi, yeah, another really good question. I think this again will depend on your specialty. We have got regular training and training opportunities during anaesthetics, for example. When I organise my rota, and for me, the HR team at my hospital send me what I don't know whether this is actually how they should be doing it, but it certainly works really well. They send me what the full-time rota would be. I put it on an Excel spreadsheet, work out the hours and make it 80% of everything for me. So I do 80% of on-calls and 80% of normal days. And then my employing hospital runs it through their software, which is called Allocate, which redouble checks that I've done the calculations correctly and that I'm doing the right amount of hours and things. So I can structure my rota to suit when I want to be around. So if I know that there's training on a Friday, then I'm going to be putting my days that I'm in as Friday, but I might not be there on, say, the Wednesday of that week. That being said, rightly or wrongly, and I often do attend training if it's virtual on my off days. I don't have to, and it's not an expectation that I do, but I like learning, and sometimes the off days will be on the Friday or whatever, and I still want to attend. So I don't know whether this year I would be able to achieve the situation that all of my training is provided during the hours that I am supposed to be working. Maybe I'm too indoctrinated to the old culture, but I don't really mind. I would prefer to get the best training I can achieve in the next 12 months, and that might not always be when I'm being paid to go to that training. Does that answer the question?
Thank you so much, Jennifer. So another question, so this one's for John. How long does it take to process a less than full-time application, and how much notice do we need to give when applying?
So in short, give as much notice as you can. If you're on parental leave and you know that you will be coming back to work in 6 months, you may want to start that conversation with your TPD as early as you can and when you can predict it. I think, as you all know, organising childcare is not something that you can do really quickly, and so if the more notice you can give, the more notice we can work around it. We generally try and process the applications and turn them around as rapidly as possible. With the pandemic, unfortunately, a lot of the staff are currently working from home, and I'm sure if you've dealt with your bank or you've dealt with the passport office, things aren't as quickly as possible. But we do try and turn the forms around as quickly as possible as they get to them. The straightforward ones can be turned around really quickly. If there is something that's a bit more complicated that needs to be escalated to myself or Shirley or Helen, where there's a more difficult process, then that will take as long as it takes, because we may need to get some more information, check on health circumstances, see what we can do. But as I said, if we do need to get you back to work quickly, that can be turned around really, really quickly and done very, very quickly. And sometimes that's just done with a phone call between me and the head of school. So again, it's individual circumstances and individual decisions, but if we need to move quickly, we will.
Thank you so much, John, and to the whole panel. I'm afraid we've run out of time. I know we've had lots and lots of questions this evening, lots of fantastic questions, so I'm sorry we haven't been able to get to all of them. As we mentioned earlier, we will be putting together an FAQs document that will address a lot of these questions, and will include some links and some key contacts in there for you. Thank you to everyone for attending this event and providing your views and experiences of less than full-time training. And a big thank you to the presenters and panel for giving up their spare time. We hope you found this session useful and informative to your future training, and we hope you enjoy the rest of your evening.